Hi, my name is Dr. Krysti Vo, and I am a adult psychiatrist and child and adolescent psychiatrist. I'm also the medical director of telehealth at the Children's Hospital Philadelphia. You are tuning in to my Ask a Doctor Q&A session, and today joining me is a child sexuality Dr. Lea Lis. We are connecting as we speak. So um, thank you, Dr. Liz. Hi.
Hi.
Thank you for having and joining us
You're very welcome.
today. So a little bit about Dr. Lea Lis. She is the quote shameless psychiatrist unquote. She is double board certified in adult and child psychiatry, and she is the assistant clinical professor at New York Medical College.
Yes,
She
I
has
am.
a bustling practice in the Hamptons where she sees patients from all family arrangements. Her book, No Shame, Real Talk with Your Kids, about
There it
sex, self-confidence, and healthy relationship, helps people pass down intergenerational wisdom instead of trauma by using modern psychotherapy techniques, which she has perfected over her many years of experiences. And she is an expert in the field of psychology and hopes to change the world in the way that we speak about sex. So, Dr. Liz, so thank you for joining. I will be moderating this interview, mainly Q&A, but at some point, if there are questions in the chat, I will ask those questions. So feel free, people who are tuning in, feel free to put your questions about child sexuality, how parents should talk to them, how whether
Anything you
anything,
want to know.
really, anything you want to know, just put it in
I'm
the
your
comment,
guest.
and then we will try to answer it. It is recorded as well. So, Dr. Liz, tell me a bit how you got into this niche subspecialty, very specialized.
Um, well, I love teenagers. I've always loved teenagers, and they're wonderful, and they interest me and fascinate me. And so when I started working at St. Vincent's, and I worked with a lot of uh, single sex relationships, and then I started working with adoptive families, and then I started working with all different kinds of sexualities, and living in the village. And I just decided that there was such a need for someone with this level of expertise in psychiatry. And then of course the Me Too movement came along, and I got really a bee in my bonnet, and I was like, well, how are we going to fix what's happening to these young people, sexual abuse and assault? And it dawned on me it was because of our lack of understanding about our own bodies, about sexuality, that happens from so early on. And that the answer was to change the way we parent kids and to change the way we mentor kids. So that's how I started doing what I'm doing, and I love it. And I'm just, passionate about changing the way we speak and approach sexuality. So that's now why I wrote the book.
Great, great. Uh, and that's a lovely journey. I think
Thank you.
uh, so. Right now, in your from your many years of experience, what would you say would be the three main misconceptions about sexuality in adolescents and children?
Well, that you know that that children are have this great understanding of their sexuality, like all of a sudden, let's say that they understand if they're gay or they're straight or they're transgender. Like, I see it as way more fluid than that. They go through developmental stages where they're very confused about their sexuality. So, you know, they might think they know, but they don't really know, right? And it's a coming of age story where they're going to go through a lot of iterations of themselves before they arrive at who they will eventually become. And even when they're adults, they're still developing and changing. So it's like these parents or professionals get really upset, and they get their back and, oh my god, my kid might be gay, or oh my god, my kids might be transgender, oh my god. And I'm like, just take a breath, you know take a breath, chill out. Like, it might be, it may not be, but you need to just be supportive of their journey and not get, that's a misconception. It's like, just, take a breath and enjoy the ride, because teenagers go through a lot of changes, and they're, they're going to have a shock and awe campaign. So, just realize that it'll probably work out just fine, So that's one misconception. Then other misconceptions is that that I don't know. I'm trying to think of what else might be another misconception with teenagers. Oh, they're not as promiscuous as you think. Everybody has this idea that teenagers are super promiscuous and they're all, giving each other blowjobs in the back of the school bus. It's actually not true. Most teenagers, the average age of sexual initiation is actually gone up from 16 to 17. Most teenagers are making very wise and responsible decisions with their bodies and their health and around sexuality. So, you don't have to watch them every freaking second. Like they're gonna, as soon as you turn your back to your teenager, they're gonna be doing like spanking people. It's like, give them a chance, trust their instincts, yes, give them good advice, but let them learn how to do things on their own and let them explore, because chances are they know what they're ready for.
Okay. So based on what you said in terms of giving advice, what do you advise parents to do or say to their kids when their kids are questioning their sexuality?
I would say that you just be incredibly supportive and you say things like, that's great. I'm so glad you're on this journey, and, what do you need from me? And, just say, do you need to speak to someone about it? So if they think they might be gay, it might be a good time for that you might bring in single sex role models into their life. So let's say you live in a very conservative community. Maybe it's the time you bring them, you seek out those kinds of people who can role model and mentor them, that are like positive influences. Or maybe it's a time, don't ever say, oh, you don't know what you're saying or doing, just bring positive influences into their life, and it's a wait and see game. I mean, and don't immediately be like, oh my God, you've come out of the closet. Like, how wonderful, just be like, you don't know until you've walked the walk and you've talked the talk what you are, right? So let's just wait and see, and be very like positive and be like, great, but you don't really know yet. You're still young. Like, let's just wait and see how you feel when you start going down the road of relationships. And, and that's what I would say. It's like,
Yeah, I think that's a wonderful advice. I think oftentimes parents can be a bit anxious about thinking being permanent or stagnant. And I think I tell parents that as well, to understand that it's called child development, sexuality development, and adolescent years are one of the critical phases of their life where they're exploring. What happens when what do you think are the negative consequences of not an unopened dialogue, or not having dialogue about it, or shaming in sexuality exploration?
Well, like gender dysphoria, in my opinion, means that a child is dysphoric because they have been brought up against resistance from the culture around them. So like, they feel like they're more, let's say it's a girl feels more like a man, and then all of a sudden everyone's like, you're not a man, you're a girl, you have to wear dresses and you need to act like this. And then that's when they get dysphoric. But if you're just like really like, okay, dress like a boy, do you want me to buy you some pants? Like, what do you want to call yourself, a different name? Okay, let's try it and see how you do. And so you don't create that dysphoria, which then causes them to get depressed, that then causes them to get suicidal. You're just like, but that being said, you're not like going too far where you're, giving them automatically like hormone treatment or whatever, where they can't reverse, because kids like change constantly. So you just want to kind of not create dysphoria. It's a wait and see game, see how they feel as they develop. And if they still stick with that, then you can take it more seriously over time. So it's like, I think you just want to be like, you want to be supportive and also understand how much sexuality changes throughout the adolescent period. It's incredibly tumultuous.
Okay, yeah, that makes a lot of sense. And then when it comes to adolescent and porn, or being exposed to such sexual content in our society, can you talk a little bit about how prevalent it is, or is it even prevalent, and what can parents do?
Yeah, I mean, it is incredibly prevalent. 80% of kids have watched pornography, higher in boys than girls, many by the age of 12. And what's really scary to me is that 88.2 of the pornography that most teenagers are watching contain physical aggression, principally spanking, gagging, and slapping, while 48% have seen contain verbal aggression, primarily name calling, and perpetrators of aggression usually male. So like they're learning a lot of gender coding and a lot of really negative stuff about gender from pornography. And because parents only 20% of parents actually know they're watching it, right? They're not even discussing it with their kids. Like you might discuss like the latest movie or the latest TikTok star or whatever, but you're not having an open conversation at dinner about pornography because kids are not going to admit that they're watching it. So all of a sudden there's no counter programming whatsoever. Like they're not getting anybody saying to them, those are actors. Like your body doesn't look like that. Like the people you're going to have sex with bodies don't look like that. And all consent is obtained off stage. And that's not what most people want. And, blah, 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 blah. And I'm like, why are parents so afraid to be like, hey, child, have you seen pornography? You're not going to get into trouble. Just tell me. Like, this is not me shaming you. This is me like being like, have you seen it? And if so, let's talk about it, because I want you to understand that, this is fiction. This isn't really what happens in most sexual people's lives, because there's also studies to show that teenagers who watch a lot of pornography are more likely to be aggressive during sex, and that the girls who watch a lot of pornography are more likely to allow themselves to be subjugated to it. So, and you're not going to be able to stop them. So, I mean, you can try when they're really young, put parental controls and all that. But once they're 15, 16, good luck, because they'll outfox you. So rather, you don't try and stop them. You just try to counter program.
Oh, okay. So that goes along to my next question of given that there's it's hard to control the content that our children sees. And we have to be at the forefront having that conversation with them.
Yes.
How do, as an organization or as psychiatrists, we can be more meeting the patients and the family where they're at, so we can combat some of these myths, or how we can educate people about sexuality more than the content that is available, like to be more accurate.
Yeah, I mean, Krysti, I can't even tell you how many times I have had a conversation with a kid about sex because they're having sex. And then the kid has like sold me down the river and gone to tell their parent that I talked to them about sex. And the parent's been like, what? You talked to my kid about sex? How dare you? And I'm to be like, your kid is having sex. Hello. I don't say that, but I want to be like, really? And it's really funny that they're that clueless, that they think that their kid is just like, genuflecting at home when they're actually sexually active at that moment. And so it's a dance between keeping their confidences in privacy, but also making the parents aware that their kid is engaging in some risky behavior and needs birth control. So sometimes, like, if the parents are really not cool with it, I'll make up some reason. Oh, your daughter has such terrible periods. You really need to get her on birth control, because I just want to get on birth control. But, if I, or sometimes I'll say to the kid, like, I think you should tell your parents you're having sex. Like, I think it's in the best interest. And sometimes they'll agree. So it's like, it's a dance for sure. And you have to do the tango. But, I really encourage kids to be open with their parents about sex, because I think it is, in the end, so much in everyone's best interest to do so. And I can be there to hold their hands through the process. And it almost every time works out to their benefit, because they can get on birth control, their parents more understanding. You can help do a risk reduction kind of situation.
And what about, what would you recommend as a psychiatrist? When do you think is the age to ask, or the indication to ask? What are some indications besides age that a psychiatrist should really go into detail about sexuality with their? Because there's only so many minutes in a eval, And so sometimes psychiatrists do those screening questions, right? But sometimes kids aren't that truthful in those screening questions. So what are the indications that you should dive into deeper with more sexuality questions?
Yeah, I mean, it's the screening questions that usually alert me. So, I ask a teaser, and if they bite, then I go down a little more of the rabbit hole. I think forced choice questions are great for that. Like, um, if you say things like, if you say things like, um, do you have have you ever had a crush on a boy or a girl? And then they have to pick, either a boy or a girl. They have to be like, I've never had a crush. And so the forced choice question makes them more likely to pick something. And then when they pick something, you can kind of then be like, who was it? Did you ever kiss that person? So I like the use of forced choice questions. I love forced choice questions, especially with teenagers. Oh, they're wonderful for things like, um, who do you get, who do you like better, your mom or your dad? It's like the awesomest question in the world. You get the best answers, you kind of just like, you go there and you just like put it out there, and they're like, sometimes they're like, oh no, I like the same, but a lot of times they're like, oh, my dad for sure, Andrew gets me so much better. Or or who do you feel you can talk to, your mom or your dad? You've got to ask these forced choice questions, and that's how you get,
Okay.
Don't ask
Great.
like open-ended questions. Forget it. With a teenager, open-ended questions never work.
Wow, great tip, because I think we're taught to ask open-ended questions. So I think when it comes to sexuality, when it comes to takeaway points for a psychiatrist is really to ask a closed-ended question, giving them A/B choices, and that's how they are forced to answer. Would you say that's kind of one of your pearls,
I do.
clinical pearls?
Yes, forced choice questions are wonderful, and the kind of like more deep they are, the better. Like, don't be afraid. Like, oh, the kid's gonna freak out or whatever. It's really interesting because you'll get the most deep answers if you ask the kind of agitating questions. I always ask agitating questions, and it's fascinating what the responses I get. Everything like with alcohol and drug use and all that. Like, I don't ask like, have you ever tried drugs? Like, yeah, okay. They're not gonna be like, no. I'll ask things like, um, uh, I'll ask something like, oh, what was it like when you tried marijuana? And they look at me like, how did she know? And then they'll be like, no, I never tried that, which is fine. Or they'll be like, oh, it was, how does she know this already? Like, so they'll either deny it, which is fine, or they'll be like, yeah, oh my God, it was so amazing. Or it was, oh, I got so paranoid. And it's so funny because like, and it's not like you can bring up, oh, they never heard of marijuana before. By the time they're 13, they know what it is. So if they deny it, fine. If they don't, great. You already got somewhere.
I like to do that as well. I always said, when was the last time you drank? When was the last time you had marijuana? I just assume, and then they will correct me if my assumption is incorrect.
Yeah, awesome.
And then what about the perspective of the media? Do you think as psychiatrists we should advocate one way or the other in terms of how prevalent social media as well as online content sexualize things, or like expose children to sexual content?
I think that it's like, eating cake. A little is okay. A lot is not good. Um, a little bit of social media is totally fine. A lot of social media can become really bad because they're taking in all these subliminal cultural messages all day long for hours a day about what they should look like, what they should dress like. And there's no counter programming because they're doing it for 3, 4, 5, 6, 7 hours a day. It's amazing how much, not just social media, but all media is consumed, an average of 6 hours a day for most children. And that's a lot of time. Sometimes for certain teenagers, 8 hours a day on their phone they're in school for 8, 9 hours a day. Then they're doing another 6 to 8 hours a day of either social media or video gaming. And there's no opportunity for their brain to take in other information because they're only taking in social media / computer gaming, whatever. And so I think that's detrimental because they also need time to just sit with their own mind and read or talk to their parents or hang out with their siblings in a noise and distraction free environment. Like I take my cue from Mr. Rogers about like how kids need some time to be quiet. And so I don't think it's healthy for children to consume that much electronics in general. I really
do you have a time frame? Do you have a recommended dosage of social media per day, or not so much?
Yeah, I mean, I think it changes as you develop, like younger kids versus older kids. But you know, I really don't think that that in younger kids more than 90 minutes a day of any electronic is, you know, it becomes like diminishing returns, I guess you could say. And for older kids, you know, no more than 3 hours a day on electronics in general, whether it be social media or video games or whatever. But many parents tell me you're crazy. I couldn't get my kids under 3 hours if, you know, I bribed them with everything in the world. So maybe I'm pie in the sky on that one.
Yeah, I am the same way. I said that how much social media exposure is a negotiation between the parent and a conversation they should have with their kid. And it should be a reward, you know, a reward from doing everything they have to do in a day. And I think oftentimes parents don't see electronic as a reward. They see that as a must. It's a privilege, but it's privilege, you know. And I think that it needs to be earned. And then, with that being said, do you feel that now that with social media being so robust and as teens and exploring their sexuality, they're even like when it comes to graphic content, there's even like pornography and porn star having social media accounts nowadays. And should parent talk to the kid about their self-image, their body issues, especially when they're going through puberty? Like how do you educate on good body confidence? Like,
oh, that's a good question, Krysti. You know, the reality is 95% of what they know about and learn about their body comes from watching you as a parent, how you treat your body. Do you denigrate your body? Are you proud? Do you walk with your shoulders back? How do you dress as a parent? Are you ashamed of your body? Do you talk about dieting all the time? That's 95% of it. Like, be a good role model, eat healthy, you know, exercise. That's 95% of it. And then the other 5% is obviously cultural messages, which, you know, from their friend groups. So a couple of things like, what is their peer group like is huge for teenagers. So if their peer group is all anorexic, they're going to be, I mean, it's just like they're going to be anorexic. So you really want to help cultivate a peer group that is very body positive if you can. Obviously, you don't always get a choice 100%, but you can help steer. It's like, I always say, make the good choices easy and the bad choices more difficult. So if there's a friend or a couple of friends that are very body positive or very good students, really, you know, are good kids, you make those play dates like really easy. I'll drive you there. Why don't you invite blah, blah, blah over? Make those choices really easy. And then the kids, you know, are like, you know, anorexic, or they're like got issues, or they're like not good students. Those kids, you make those choices a little harder. Like, oh, I can't drive you right now. I'm so busy, you know, and you just do your best to like help shape their choices. You can't like forget, you know, you don't want to make it a star-crossed lover situation where you're like, you can't see that person because that'll never go well. But you can help make the good choices easy. And that's what I think you should do. So you really want to look at peer group influences as much as you can. And then the third thing is, you're not going to be able to keep them away from social media, but talk about it. You know, like a lot of these kids are following these like these anorexic, like, you know, models and things. And like, they're just really toxic. And, you know, you gotta be scrolling through their social media with them and be like, what do you think of that? What do you think about that outfit? What do you think about what they're saying? And what do you think? And you got to just make sure that there is some counter programming and other messages that they're hearing.
Okay, that makes a lot of sense. So I know we have some new viewers right now. I want to let them know that they can always ask a question to Dr. Lea Lis,
Yeah.
child sexuality expert and psychiatrist here with us. And so feel free to put in the comment any of your questions you have. We were just talking about how do you talk to your kids when they're viewing sexual content and how it affects their body image. So with that being said, if you were to have just like a take-home point for clinicians working with children, what would be your take-home point?
Working with children around body image?
Around sexuality, body image as well.
Oh, well, for body image, I really like, one thing I like for clinicians to do is I create like a circle, and in it I ask the teenager to put everything they think about their body, starting with the top of their head to their feet. So I go down. What do you think about your hair, your forehead, your eyebrows, your eyes, your cheeks, your nose, your lips, your mouth, your throat, your breasts, your stomach, your back, your blah, 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 all the way to the feet. And I write down everything they say, and I put it in like a circle. And then I say, wow. And I'll look at the circle, and a lot of, sometimes the kid is healthy with their body image, but a lot of times I hold up the circle and I say, who is this person? This sounds like a monster. Like bad eyebrows, frizzy hair, like crooked teeth, acne. Like, wow, I think this is right out of the BMG, like, what is it? Like, who is this monster? And then
you exaggerate so that they know that the severity of how they're viewing themselves.
Yes. And then I say, okay, let's go through it again. And I want to see what I see. And then we go through it again, and I say, oh, your teeth are white and straight, and your blah, 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 and, and your body is healthy, and your breasts allow you to nourish your child someday, and, you are strong, you play sports, you can dance, you can do all. I was like, wow, that's a totally different, circle here. And then that's how I help, I really go after body image very directly, because a lot of times it's just. And then I say, would you say this about your friend? Would you say that they had, acne, and why would you treat yourself so badly? But you would never say that to a friend. So are you going to bully yourself for the rest of your life? You're just going to be the biggest bully ever to yourself. And so that's how I work on body image, and it really, really helps.
Great. So we are wrapping up. This was meant to be a 30-minute session. So I do want to talk a little bit about your experience with APA. I know you were on the board of American Psychiatric Association, and I'm actually running for the board. And the election starts January 4th to February 1st. I'm running for the early career psychiatrist spot, and every member vote for that spot. So if you were to think about in terms of what APA can do as an organization to advance, let's take it broader. Let's say psychiatry, or even how APA can be educational to the public regarding psychiatry. What would be some things that you would advocate for?
Well, Krysti, you got my vote, Dr. Cho. You got my vote. And as far as psychiatry is concerned, what we can do to advance the field of psychiatry is, I think we need to get way more involved in developing curriculum in schools. So like, we've really not done much about that at all. And so if you look at we have not advocated enough to create a sexual education curriculum in schools that is actually going to change the future of children. We take a backseat on that. I think it's a shame. The other thing that I think the APA needs to do more in the space of sexuality is not to be afraid to lobby, local communities around, giving free lectures. Like, psychiatrists could put together something in a local community forum for parents. We could volunteer as psychiatrists to speak at a school around talking to your children about sex. We could do a lot more of advocacy work around sexuality and sex, because I think we're generally quite afraid to embrace it and talk about it in a really open way, which to me is a shame. I mean, I don't think we do enough there.
I agree. I am very big on educating the public. I think psychiatrists and APA should be on the forefront of educating mental health related content, because there's so much content out there that there's so much misinformation as well. So I think we have to be the reliable source of information for parents and families.
Yeah, I agree.
Yes. So well, with that being said, I don't see any questions from the audience. So I wanted to wrap up by having you say your I guess wrap up about yourself and what your last minute message to our audience.
Well, I'd love for everyone to check out my book, No Shame, Real Talk with Your Kids about sex, self-confidence, and healthy relationships, and to follow me, because I'm going to start doing actually a lot of educational content, webinars, things like that for parents, but also eventually for kids directly, to promote this idea of, advocacy and, raising healthy children. And if I could give everybody a tip right now, it would be, do not be afraid to ask your kids direct questions about sex. Like, do not be afraid to be like, are you having sex? And if they say no, you have to immediately say, okay, if you think you want to or you're ready to, please come to me. I will not get upset with you. There will be no judgment. I'm here for you. Don't be afraid. Go for it, because it will make you so much closer. It will do wonders for your relationship. So that is one thought, one pearl I can give today.
Yes, thank you so much. And then so everyone that tuned in, thank you so much for watching As a Doctor with Dr. Vo. Today we had Dr. Lea Lis, our child sexuality expert and psychiatrist. And hopefully you both can follow us, Dr. Lis at Shameless Psychiatrist, and then me at VoCare. And if you're an APA member, remember to start voting.
Vote
January
for
4th.
Vo.
Yeah, vote for Vo. Okay, tune in next week, 7:30 Central, 8:30. Sorry, 7 Central, 8 Eastern.
Bye.
Thank you.
Take care.
Take care.